The Body Shop with Meredith McDonough and Dr. Steve is brought to you by Allegheny Chesapeake Physical Therapy.
Good evening and welcome to this week's edition of The Body Shop with Dr. Steve. I'm Meredith McDonough. This week's topic, knee pain and arthritis. So Dr. Steve, we're all getting older. Is it true that arthritis occurs more as we all age?
You're correct, Meredith. The older we get, the better chance or the greater chance we have of having osteoarthritis, which is sort of a wearing out phenomenon of the joints.
So Dr. Steve, can you explain to us exactly what happens to the knee joint?
Sure. In arthritis, what happens is the surface, which is a sort of slippery surface called the articular surface, it's the end of the bone from the femur to the tibia, the lower leg. That surface is normally like ice. It's smooth, it's silk, and it allows the bone to slide on itself.
Okay.
As you age and as arthritis develops, it doesn't necessarily have to be age-related, but as it develops, that smooth surface has little pock marks in it or little indentations, and then it starts to actually wear away. And when it wears away progressively, it gets to the point where your arthritis is so bad that it can't slide or move. Same analogy with the ice is after you put the Zamboni on an ice rink, it's nice and smooth and slick and slippery, but after people have skated on it, it gets rough and it gets holes in it. The same thing happens to your knee joint.
Oh, jeez.
It's not smooth movement then.
Well, are there options for people with arthritis, or is it, a total joint replacement is your only way?
No, actually, there's a lot of options, and it's sort of a progressive disease, as you can see. So anywhere along that progression, you can do many things. Exercise, interestingly enough, is one of the best things to do if you have osteoarthritis. When I started 25 years ago, we used to tell people don't exercise, back off. Now we tell them actually exercise helps, decreases their pain, increases their motion, increases their function. Progressively, as you go further in the disease, you can have steroid injections. You can have, to decrease the inflammation, you can have hyaluronic acid put in, which sort of returns that slippery surface. And also there are joints and surfaces, like this example here, that has more arthritis on one side of the joint than the other, and there are braces for that you can wear that decrease the pain also.
So Dr. Steve, I'm sure lots of people suffer from arthritis. I'm sure you treat tons of people every day. What about the people at home? What are some pearls of wisdom that you can give them?
Number one, I think, is that anyone that has a diagnosis of arthritis should not sort of stop doing things and try to protect themselves. What they should do is consult a physical therapist, get an exercise program, because the exercise program will help with their motion, decrease their pain, increase their function. They'll be able to live with it much better. So exercise is one. And then also consulting a physical therapist or any medical professional will give them other options. Where they fit in that pattern as they progress will make a big difference in their lives. So they can be functioning. They can usually participate in many activities, sports and other things. With the diagnosis, they just need to have a dosage-specific program.
As always, you're the best, Dr. Steve. Thanks so much for this week's segment. And if you have any questions about arthritis, all you have to do is give Dr. Steve a call at 1-800-332-5740 or log on to www.alleghenychesapeake.com, and all your information is right there, huh?
Great.
Okay, thanks, Dr. Steve.
Thank you.